Hello and welcome to Wellbeing. I'm Dr. Virginia Reid, and today on the program to discuss the very interesting subject of social prescribing, I have Professor Alex Haslam, Professor of the School of Psychology, University of Queensland. Welcome, Alex.
Hi, Virginia.
So, Alex, what is social prescribing?
Social prescribing, in very kind of simple terms, is an alternative to kind of medical prescribing. So the first is that when people go to their GP because they've got some kind of condition, it turns out that in a range of conditions, one of the kind of underlying contributors to people's lack of good health is social isolation, lack of connection, if you like, in very simple terms, loneliness. And social prescribing is really a strategy to target that loneliness by focusing on building social connections amongst people in a way that addresses the underlying causes of these other ailments.
And so if, for example, somebody came to see me with a sore throat, then I would prescribe, looking at the symptoms and doing a physical examination, etc., I'd try to decide, is this viral or bacterial? And if I was on the grounds of, I could do a swab and then I could prescribe, but by then they're probably going to be a whole lot worse or better. So our management of sore throats is actually not all that scientific, but it's probably on fairly solid ground once I prove that there's a bacterial infection and I use the antibiotic that works. Social prescribing is not really at that stage yet of evidence, is it? Evidence base.
One might imagine that the evidence base for social prescribing is not that strong, but actually I would argue that it's actually very strong indeed, and in many domains far stronger than lots of kind of medical conditions. If you just take that example, which I think is a pretty good one. Okay, so someone turns up at the GPs and they've got a sore throat or some other kind of minor ailment. They may have a sore throat, and indeed there's lots of times when we have ailments of that form where we make a decision about whether or not to go to the doctor, and sometimes we do go, sometimes we don't go. Well, actually, the reality about that ailment is it can benefit from antibiotics and some course of intervention, but potentially, particularly the motivation to go to the GP is not necessarily, medical in cause. That potentially the reason that person has decided to go to the GP about this ailment, let's say it's relatively minor or unclear what its actual underpinnings are, which is true of a whole raft of medical conditions, of course, that, if you like, understanding the latent, hidden motivations for people to go to the doctor is what, if you like, alerts you to a non-medical sort of path.
If you attempt to apply a purely scientific model to health, for example, there are risk factors for heart disease like depression, like smoking, so I know that I need to try to eliminate those or manage those, like hypertension, in my patients. But the one about loneliness or depression is a far larger can of worms. And I, as a GP, would like to know the evidence base for social prescribing so that I am on solid ground when I actually prescribe, something like Men's Shed, for example.
Yes. Well, I think, as I say, you're right that the sort of the manifestations, the forms, and the sort of impacts of things that are going to benefit from social prescribing is vast and actually rather non-specific in a medical sense. So it can manifest itself in lots of different ways. Lack of social connection feeds into all manner of ailments and concerns. Obviously, some pretty major psychological ones. So just some sense of distress or vulnerability, which then, gives rise to other medical conditions. So the evidence base, it shows very, very clearly that, firstly, that lack of social connection feeds into a whole raft of medical conditions. That's the first point. And it is a major cause of ill health and indeed mortality. Indeed, meta-analysis suggests that social disconnection is probably a bigger risk to mortality than just about anything else that you could identify. Smoking, lack of exercise, poor diet, and so on, air pollution. All of those things are bad, okay, but they're not as bad for your health as social disconnection. So that's the first point. And then the other point is the evidence that if you can successfully connect people with others, so that, and in particular, that's our own research, if you can get them to join meaningful, valuable social groups, that has very positive impacts on their health outcomes. And indeed, the number of times they need to go to see a GP. So if you can get a person who goes to who's a sort of frequent attender at a GP clinic to join one social group, that reduces by about 30% the number of visits made to a GP. So I think it would by about one a month.
In the studies, what were the interactions that people did that decreased their visits to GPs? What were the type of activities?
Okay, so there's a couple of key issues that I think come out of our research and our reviews of relevant research in the field. The first is that the really beneficial things for health and for social connection are not just, if you like, getting people to have a bit of social contact, some random social contact with other people. Getting them to join social groups, whatever those groups are, is beneficial. So it seems to be group-based connection is critical. And the other point there is, I think it's easy to look at what the groups that are effective are, and you can list them. You can have recreational groups, you can have men's shed, you can have sporting groups, all sorts of groups that people can go and join. I think one of the things as a prescriber you have to understand is it's not just knowing that men's shed are effective and saying to someone, oh, you should go and join a men's shed, probably isn't going to work. What you have to do, in as much the same way as if you're prescribing a drug, is know something about your clients and have a conversation with them about what groups are likely to be meaningful for them and work with them so that the kind of intervention is a co-production between you and the client. And and the specifics of that is what a lot of our own research is about too. We have a program called Groups for Health, which effectively goes through a process of having a structured interaction with a person. Actually, you take part in this program in a group so that the group itself provides an opportunity for people to kind of work through some of their issues, to test out some of their strategies, and to get some support and circle back to look at the impact of the things that they attempt to do. Because again, if you are disconnected and isolated, it is difficult and threatening and often hard in a very real sense to just go out and join a group. And someone just saying, mate, you need to go and join a group probably isn't going to work. So what we have a program, this Groups for Health, it has these 5 stages to it. But one of them, and I think the critical bit for health professionals, is the idea of scaffolding support, so that you provide some support as people go into those places. And then once they're established within their new social networks, new social groups, you can take that scaffolding away. And the beauty of that, compared to all other interventions, pharmaceutical, psychological, is that groups are the most naturally sustainable source of well-being on the planet, because they're what we've evolved to live in. So when you stop, if you like, supporting people in groups, and once they've internalized the group as a meaningful part of who they are, then they're just going to want to carry on being in the group, and then it's all kind of good. Whereas, of course, in most other therapies, once you stop administering the cure, whether it's psychological or pharmaceutical, then actually you're likely to see some recidivism or some recurrence of the initial condition. But that isn't the case, I think, with effective social prescribing. So one of the things, when people think about social isolation, social disconnection, they think, oh, well, maybe what that person just needs is a couple of friends, or just to go and have some interpersonal interaction with another person, or a bit of a chat. And that actually, that's not going to do them any harm. That's certainly the case. But our evidence suggests that it's getting embedded in some meaningful social group with a reasonably large number of other people, where the group provides some collective goals and purpose and direction that, if you like, makes the activity meaningful. That's the critical point. So that's just social psychology. But just to give you an example, right? If I go to you as my GP might say to me, look, Alex, why don't you just go into a football match, go and watch some AFL. Okay, because actually, because if you go there's lots of other people and you'll have a sense of social connection. Well, the obvious point there is if you don't know anything about AFL and you don't it's meaningless to you, then you go along to that event and you're going to feel actually worse. You're going to feel like a stranger. You're going to feel like an outsider. You're probably going to feel a bit just weird, and it's not going to be a pleasant experience. However, if you can come to like AFL and everything about it, and then with some other people live out that collective identity, then going to an AFL game has meaning and purpose and seems kind of significant, and you can talk and interact in a rich and kind of profound way, which you can't in the absence of that group identification. So coming to identify with the group and internalizing it to who you think you are. So you say, I'm a Crows supporter, I'm a Lions supporter, or whatever it might be. That's really the critical psychological step. And a large part of our analysis is often what's driving things like stress, paranoia, depression, is that lack of identification with other people, the sense that you're on your own and everybody else is a stranger to you psychologically. So it's the loss or lack of social identification that often underpins as a sort of transdiagnostic sense all of those other kind of conditions. So if you like, targeting group identification is obvious remediation. And just speaking to that, again, where we came into a lot of this research was when we were doing epidemiological stuff, and indeed showing that, lack and in particular loss of valued group memberships is probably the major trigger to psychological distress of various forms. So, what makes people depressed? Well, becoming unemployed or losing a family member or some sort of trauma that affects them and means that they lose some group membership that was meaningful to them. And as we know, that's a huge threat, not just to their psychological health, but also their physical health.
Yes, I can imagine. You're listening to Wellbeing. I'm Dr. Virginia Reid, and we're talking about the fascinating subject of social prescribing with Professor Alex Haslam. So, Alex, is there a structure at present whereby one can understand the groups that are available in one's local area?
I think there are networks out there, like in Brisbane, there's a charity, RecLink, and what they do is take people who are vulnerable, people who are homeless or have gone through some personal kind of distress or event that's put them made them vulnerable, and they kind of work with them to identify recreational groups that might be beneficial to them. And indeed, that's a very, very good program. It's very effective, and it produces very significant positive outcomes. So yes, there are, I think, lots of informal groups that kind of do that. And I think also, within communities, there's lots of groups that fulfill or seek to fulfill specific needs that people might have. Last week I was at the Retired Business People's Association. This was people who are, who'd retired, and obviously they no longer have this work-based group to be part of, so they join a professional group and they meet once a month, and they can do the sorts of things that they were doing previously. They do volunteering and blah blah, and that very effective. So I think those things are out there, and most people, to the extent that they're feeling, I need to be doing something, seek those agencies out, and in the normal course of events, I think those things work well. I think the more problematic issue are indeed people who are maybe presenting a lot at GP surgeries, who lack maybe access to those types of groups, and perhaps also lack the kind of support that would plug them into that kind of social matrix, if you like. And it's that particular gap that I think we see the critical need is. So indeed, precisely the sort of people who are turning up at doctors' surgeries. And the evidence is, again, some of our own work, that if people around that space can help people to join groups, then it has actually huge positive impacts on the well-being and actually the presentation for medical treatment. So it's a hugely effective intervention, a hugely effective strategy, because actually, again, the root cause of a whole raft of conditions is lack of social connection, social isolation. Yeah.
But, for example, if I'm looking at heart disease and I'm looking at the statins and the antihypertensives, now my patients wouldn't be able to afford them if they weren't on the PBS, Public Benefits Scheme.
Yeah.
You're saying that this intervention is perhaps more potent than those.
Yes.
Is there funding available for those organisations to be able to, if you like, market themselves and be known such that people, when they become redundant or retire, or, I'm not talking about people that are homeless, etc. I guess I'm talking about your average person that I want to make a more healthy, just like I advise them about a better diet, I'd prefer to be able to advise them about things that are good for their health that I don't write on a prescription pad.
Yeah, no, absolutely. I mean, so I think the answer to that is there is some sort of funding. I think there's a couple of issues. One is that the funding for these kinds of activities, or the groups that promote them, has actually dwindled at the very time that we need them most, because of the kind of atomization and the rampant sort of isolation in our communities. Actually, those groups are increasingly under threat. I think that's a really tragic irony. So that's the first point. But one of the reasons for that is that in a context of some sort of general sense of the need for austerity, often these are the first things to go. Our argument is actually, if you're looking at the epidemiological data, these will be the last thing you would want to cut. You would want to cut everything else before you cut these, but that's another story. What I do think isn't there and hasn't been and really needs to be is an integrated national strategy which really brings together the key kind of players here, the key bodies, and indeed provides, templates for the different kinds of people, both practitioners, but also, members of the public who might find themselves in these kind of situations, to guide them through this kind of process and have a kind of joined up set of policies and practices and activities, and indeed funding sources to put those things together and to build up the evidence, and indeed point to the huge benefits of getting this bit of policy right. So that's something that we and I think other people are really starting to get onto, because I can say between us there's about half a dozen of us at UQ who work on this. I would say I would get at least one email a day from some community group saying, look, we've just had our funding cut and we need to make the case for us to build a new community hall, or to have this kind of activity that we're doing in this particular space. And we know that it's very valuable, but we can't get the evidence to present to the relevant authorities. And in the absence of that, we fear, or we know, that we're going to be cut. So can you help us, please? Well, the answer to that is, we can try, but you can't really do this thing one group at a time. You need, I think, a much more integrated, coherent strategy. But I believe the pressure for that is growing.
I do too. And is there one particular place where they could go to quote the research that had been done, the papers, etc.? Because in medical, when people are giving talks, etc., in conferences, they have to reference their talks. And the reference list at the end of the talk is every bit as important as the talk itself. In other words, what is the evidence for this therapy? How long has it been going on for? And, does it work?
Well, we actually, the five of us at UQ, just writing this book, The New Psychology of Health, which documents, chapter and verse, the evidence in relation to a whole raft of conditions, everything, depression, addiction, even pain, that actually there is evidence that, very clear, definitive evidence of the value of these things, and indeed the value of intervention. So that you're absolutely right that there is a real need to have a source that you can go to provide an integrated answer to those questions. And that's really what we've spent 5 years doing. And I've got it in my hand here. It's a 490-page book. And I think it's pretty authoritative, and it integrates hundreds and hundreds of studies from all around the world. I mean, the really good news is I think that evidence base is firstly growing, and secondly, very, very compelling.
And being collected together.
So, yeah. And
is that book freely available?
Yes, it is. And if you just put in The New Psychology of Health, you'll find it. And again, if for any reason you can't access it through a library or whatever, then contact us, and we'll certainly, pass on relevant bits of information. And again, I think actually what's powerful about the book is, on the one hand, how we deal with it, as I say, a range, it's got 15 chapters, I think, dealing with different kind of conditions. And one of the key messages there is for something that we, or colleagues in the UK, refer to as horizontal epidemiology, the idea that actually, there's a huge amount of comorbidity with a range of conditions, and the underlying causes that are common to a raft of illnesses and conditions is one associated with social isolation. And you find that in pretty much every domain, the process of creating meaningful social connections, which again, I would want to say is easier said than done, but the process of doing that is, therapeutically massive in terms of the outcomes. And in a whole range of contexts is an untapped source of what we refer to as the social cure. There's a great line actually by Robert Putnam, who's a political scientist in the United States, and he was one of the first people to really track some of this stuff. There were some other people in the 90s, and he wrote a book called Bowling Alone, which was really just about the ways in which American communities were disintegrating and what the human and social cost of that was. But he just made the observation based on, huge national data sets that if you were, I think, aged over 50 and you had a choice between joining a group and giving up smoking, it's a bit of a toss-up which of those would be better for your health. And actually, of course, the point is that for a lot of people at that age, it's an awful lot easier I've said it's difficult to join a group, but it's a lot easier than often giving up smoking or some other kind of, as it were, bad habit that you might have. And the other point that kind of we make about like joining groups and social connection is like, well, what's the worst that can happen? I mean, there's a whole raft of, if you're desperate for kind of some treatment or some remediation, well, there's lots of things that you can do that are actually going to be very deleterious to your health. But actually joining a group, the worst that might happen is you might actually enjoy yourself. And of course, the point is precisely because you do in a meaningful way that they're good for you. Actually, the mechanisms is another whole other story that we talk about in the book. So what is it about groups that actually has this health enhancing benefits? And I think that's a very interesting story in itself. And obviously that's psychologically mediated, but a lot of that is to do with the capacity for groups to provide solid structure for not only for your, if you like, your view on the world and your cognitions, but also the way in which you engage in the world. So a colleague of mine at UQ, Jen Dingle, done a lot of stuff on addiction. And again, one of a key finding from her work is that the most, if you like, reliable route out of addiction is joining a group whose members engage in a way of life that is not doesn't involve using toxic substances. So again, why is that? Well, then because those new groups are going to provide you with things to do that structure your thinking and your actions in healthy ways, and again give you this sense of purpose that is actually often lack of purpose and disconnection often underpins all form of addictive behaviours.
I would imagine too that there'd be a lot of other aspects to, groups in general. I do bush regeneration with a group of people once a month, and the fact that we've transformed a little park that was pretty dingy and dreadful into a nice park that everybody comments on, and I'm getting healthier doing it because we know that gardening's good for osteoporosis. Blah blah. I mean, it depends. You'd match the person with the problem, and what I'm getting at, I suppose, is if I just Googled bush regeneration in my area, yes, it'd be okay because that's fairly popular. But if you have somebody who not sure if they can do that, etc., it'd be really lovely if this evidence base could become more of an issue, if you like.
Yeah. And again, I think, so if you were to reflect on the process through which you came to join that group, again, it's probably that some friend alerted you to it and said, oh, you're probably going to get something out of this. And they understood you and you had a conversation and you understood the fit between you and that activity.
That's what I'm talking about, the fit.
Yeah.
And so how do we expose people to a range of groups that they may fit with?
Yeah, that's right.
And because this evidence is not out there, we don't have that on the agenda, really.
Said in Groups for Health, we have there's these 5 S's. And one of those is sourcing, which is really getting people to just reflect on the groups that have been important in the past for them and maybe are important now, and to ask them the question, well, let's say, for example, I have a conversation with you and I find that, well, actually you quite like reading, or that you, or you're interested in politics. And I can just say to you, look, that's interesting, but are you in a group that helps you to talk about politics or the environment or reading or whatever it is? So often you find that people have those interests, but they're not being fed into any sort of collective activity. So again, the key part of the social prescribing bit is have that conversation, get often self-realization on the part of people that, actually this maybe joining a group of that form would be good to me. Maybe I would enjoy that. And so just, again, gently directing them in that way. And again, getting them or taking them along on that journey. Because again, if you're anxious or nervous or concerned about interacting with other people, which is something, that obviously that large numbers of people are, just being told to go and join a group can be very aversive. But in Groups for Health, one of the things that we do is bring people together, have a range of vulnerabilities, to have those conversations. And actually, one of the things you discover is that pretty much everybody has those doubts and uncertainties. There is a resistance to this message. One is that people say it can't be that easy. The other thing I would say, and this is a more kind of a plea, is that often when we submit research grants to medical bodies and so on, they get knocked back, not by the professional people, but often by the lay people on those panels who say, oh, no, this isn't very scientific. This is all very lay. And actually, it isn't. It is totally scientific. There's nothing not scientific about it at all. The evidence base is really clear. Again, when you hear people say these things, do not say, oh, this is just soft science. This is actually very hard science with very hard data behind it, and it's got a very hard message. It doesn't fit with a particular way of understanding health and the kind of industries that might support health. But the evidence base, I would argue, for the things we're doing is no less strong, and in many ways much stronger than it is for a range of conventional medical interventions.
Yeah, so it's going to take a paradigm shift, and those things always take a little bit of energy. And I thank you very much for having done all that you've done so far, because I'm sure that energy has come from somewhere.
Yeah, and it comes actually from, you get passionate about this because you go out to some community group on the edge of Brisbane and you see actually how much people need these things, and then when they do get them, how much they benefit from them, and often how surprised they are at how beneficial they are. So it's kind of like, but what I would say too is it's a message that kind of grows on people, and I think it's something that you appreciate as you sort of progress through life, when you start to look forensically at where were the things. So if I just asked everybody who was listening to this program, when do you think you have been the best person you could possibly be? When do you think you've been the best that you can be as an individual? And the answer I'd hazard is almost definitely when you were in some group setting doing something meaningful that you thought made a difference to the world, like regenerating your garden, or even just getting your family together for some event, or organizing a wedding, or whatever it might be. Those are the things that make life meaningful. And actually, of course, what you find nowadays is that it's harder to have those things, to do those things. So think about it. Every time you organize or help to organize an event of that form, you're not just having a good time, you're actually making everybody's lives better, including your own.
And I'd ask them to then have a little feel on their heart and see if it's happy, and does that happiness equate to good health in your heart? You betcha. Absolutely. Yeah. There's a lot of evidence for that depression's a major risk factor for cardiovascular disease, which is still the major killer. I thank you so much for your time. You've been listening to Wellbeing. I'm Dr. Virginia Reid, and we've been discussing the very fascinating subject of social prescribing with Professor Alex Haslam, whose book, The New Psychology of Health, and if you would like to see that or hear anything else that we've been discussing, you can just Google Alex Haslam. So from all of us here at Wellbeing, we'd like to say we wish you well.